Good morning, everyone, and welcome to the Manhattan Family and Provider Information Committee meeting. Thank you for joining us. My name is Wendy DeLeon, and I am the co-chair of this committee. And I'd also like to welcome Lisa and let her introduce herself.
Hi, good morning, everyone. My name is Louisa UC Roche. I am a regional director at Care Design New York, one of the 3 CCOs in New York City, and I co-chair this committee with Wendy.
Thank you, Lisa. And that reminds me, which I should have mentioned as well, I am the Director of Housing Assistance Services at ADAPT Community Network. As you can see by my background, how dare I forget? But again, I want to welcome you all to our November meeting. We will be discussing some new initiatives or just bringing to light some resources that we think can be very helpful to people supported, their families, and also just for our colleagues, our professional colleagues to know about in order to inform the people we support. But before we jump into that, I do want to give people just an opportunity to make any announcements. Um, for those of you not making announcements, if you could please just mute yourselves, that would be greatly appreciated. Um, but for those of you that want to make an announcement, just please raise your hand and I can call on you so we can try to keep this as organized as can be. And if you don't want to make a verbal announcement, then by all means, please be sure to share the information in the chat. I can begin if people are shy. ADAPT Community Network offers a variety of services, including housing advocacy, family reimbursement, and home modification services in all 5 boroughs. In addition, we have day-hab services, clinical services, um, overnight respite services, and on and on. Please visit our website at adaptcommunitynetwork.org for a more thorough list of services provided.
The electorate, Congressman Curbelo. I'll just periodically pop through and mute people that have maybe mistakenly unmuted themselves. So if anyone wants to chime in with anything else, then they can raise their hands and we'll make sure that that works that way.
Perfect. Thank you, Lisa.
There's a hand.
There's a
from
hand.
Sinetia.
Yes.
I see a hand.
Hi, my name is Hercauris Lara from Synergia. I'm the Manhattan case manager and special education specialist here that runs the education advocacy program in Manhattan. So I wanted to stop by and say that we have open slots for families that need education advocacy for families that reside in Manhattan, ages 3 to 21. And if you are OPWD eligible, you can always reach out to us. Also, in our family support case management program, we are taking new families for Manhattan, Bronx, Queens, Brooklyn, and if you would feel like you need our assistance, you can always reach out to us. I'm going to put the information in our chat. So yeah, thank you.
Thank you.
Thank you. Any other hands up?
I don't see any other hands at this time.
Wow, this is a shy group. Okay. Well, again, the chat is always available. So by all means, please add your information there as well. So I do see that there's 4 people that will be speaking about different programs today. I will leave David for last since David's presentation is just a little longer. But I do see William, and I hope it's the right William here, as having joined us from CSC Peers. If that's the case, could you please unmute yourself? Hi, William. Thank you so much for joining us. So, as I mentioned, William is from CSC Peers Social Skills Program from NYU Langone. I always feel like I mispronounce that last part. But he will be talking to us about the social skills program. And again, these presenters today are speaking about programs that are available for through family support services. Um, these are programs that, you know, may not get as much attention as family reimbursement, let's say, or you know, our other sort of more popular services through family support, but are very much needed. And so the purpose of this meeting today is really to highlight these kinds of services because, folks, if we don't use them, we lose them, and we don't want to do that. Some of these programs are programs that Janet Davis had mentioned from just going through the list from last year. Some of them are just programs that I found through our Family Support Services Directory, which is available through our Manhattan DD Council website. So without further ado, William, if you'd like to begin.
Yes, and thank you so much for the invitation, Wendy. Really do appreciate it. So once again, as Wendy said, my name is William Moitoza, and I'm the Senior Project Coordinator for the Child Study Center Peers Program here at NYU Langone Health in Midtown Manhattan. And so I would love to spend a few minutes talking about our program, and it's a bit of a watered down version of it given the time, but I'll try to cover it as much as I can, as best I can, and if there's any questions, please feel free if that's okay with Wendy. And so without further ado, I will share my screen and begin. Oh, Wendy, it says that the screen sharing has been disabled.
Give me just one moment.
Sure.
Okay, see if it works now.
Yes. Can you all see my screen? All good?
Yes.
Okay, perfect. Let's get this right into the slideshow. Okay, fantastic. So I'm just going to talk a little bit about our peer social skills program, and in the dialed down version. So to give you a little bit of a background about our peers program. So it was developed by Dr. Elizabeth Laguson and her research team at UCLA back in 2004, and it's been used since then in over 85 countries. And it's also it's one of the few groups the peers program is really one of the few groups that has gone through randomized controlled trials for teens and young adults, and now for preschoolers. And they're very strict research protocols to go by. And so what they've really come across in their research findings is that they are, like, the teens and the participants who take part in the group, they show significant improvements in both the parents, or as they're also called, the social coaches, and in the individuals. They reported with social skills, hosted get-togethers, and these social gains that they've attained. So these gains have been maintained or even improved upon at the 14-week point of them attending our program, and up to 1 to 5 years following the completion of our program for teens. And our preschool program, they've also shown a significant decrease of those who have attended in social skills and challenging behaviors. And again, also for the preschoolers, like the teens and the young adults, these gains have also showed that they've been able to maintain them up to 5 years after completing our group. So what are some of the key components of our peers program? In other words, what is unique about peers, and what are the components of a social skills program that are needed to support social skills? So one of the main factors is that it's caregiver assisted. So and by caregiver, it's like it's a parent, it's a social coach, it's anybody who's really able to be to be a consistent presence in the attendee's life who's part of our program. And what these social coaches learn is that they're given all the skills that are taught to the participants, as well as these coaching strategies, and this really helps them with generalization of the skills. So they're very, very active in the group along with the participants, and so their roles are equally as important, so that the teens or the young adults or preschoolers are able to take the skills that we're giving them, we're teaching them, and practice it with them like outside of the group. And another key component, so ecologically, it focuses on ecologically valid social skills. So with this part right here, so a big thing is what would be considered, like sometimes the social advice that we might be, giving to like others might not be considered might not be effective in terms of what would be considered, for someone who's like considered like socially successful, quote unquote. Like just to give you an example, like there could, if we might say to somebody, oh, you can just go and talk to this person, go introduce yourself. But if it's a situation where there's a big group that's happening, and this person goes up to this big group and just suddenly starts saying, hi, my name is Will, out of nowhere, that can be disarming. So what we really try to do is to really just kind of break down the social, like these skills and learning blocks for what would be like ecologically valid for teens, for young adults, and for preschoolers, and just really break them down very, very clearly, like bit by bit, so that they're very tightly analyzed. And another factor that is a key component is that the homework assignments that we give to everybody who's able to attend. So these are given weekly, and they're mainly focused on on practicing the skills that are the focus of that particular week, and they're able to practice these skills with each other. Like it could be an example of one attendee giving somebody else a phone call to just like have a conversation with them, and then the social coaches or the parents, they are playing an active role in this as well. And really just the concrete steps, rules, like the do's and don'ts of social skills. And another big factor during the groups is there are a lot of visual examples, like that come with in the form of role plays, and a lot of opportunities for them to practice these skills that they're given. So a brief just overview of the curriculum for our teens and young adult programs. So it's really broken down into two categories, like making and keeping friends, and handling peer conflict and rejection. So in making and keeping friends, finding and choosing good friends, conversational skills, starting and ending conversations, exiting conversations, electronic communication, which is a very big one these days. Good sportsmanship, being able to have get-togethers, and one thing that our young adults group also has incorporated is skills related to dating. And that's only for the young adults group, not for the teen group. And with handling peer conflict and rejection, so just how to resolve disagreements when it comes to teasing, cyberbullying, physical bullying, even rumors and gossip, and changing negative reputations. And our peers for preschoolers group. So the topics that we cover here are as follows: listening and following directions, meeting and greeting friends, sharing and giving a turn, asking for a turn, keeping your cool, being a good sport, show and tell during playtime, being flexible, asking a friend to play, joining a game, asking to play something different, asking and giving help, staying in your own space, using inside voices, and then how parents can play a supportive role during play dates with their preschooler. So what is the inclusion criteria for our group? Like what do we look for that we would think would make a good fit for a participant who would want to attend? So for teens, the ages are 13 to 18. I'm sorry, 13 to 17. I'm not sure why it says 18. And the young adults are ages 18 to 35 and preschoolers ages 4 to 6. And there is no specific diagnosis required for them to join. Like we would not, we would do, like we do phone screens. And if someone were to say that they, if someone doesn't carry an autism diagnosis or any diagnosis, that would not be an exclusion criteria. Like as they would still be able to attend the group if they would want to work on a particular social skill that they have. And really what the main factor is that we look for and assess is in terms of whether or not they would be a good fit is if the individual is truly interested and really motivated to participate in the group for the entirety of its time that's being run. So for the full 15 to 17 weeks that the group would be running for, we want them to show up every week ready to commit to the homework assignments and being an active member and really ready to get the most out of the group. And then there's another requirement is making sure that they all have a social coach weekly in addition to the participant. So it's that's a requirement for the young adults, for the teenagers, and for the preschoolers. So we would not be able to accept anybody who could not identify a social coach for the group. And our current offerings that we're having right now. So our young adult program. So this will be starting on January 11th, and it'll be running for 17 weeks, for 90 minutes each week on Thursdays, starting from 5:30 p.m. until 7 p.m. Our teen program, that is a 15-week long program, which will meet which we're currently running. And this is for 15 weeks for 90 minutes again each week in person. This meets on a Tuesday. And while we have closed registration for the fall program, we will be offering this program again come March. We haven't determined when that will be yet, but it will definitely be occurring again in the spring. And our preschoolers group. So this is going to be, we will be running this fall. We actually just started this program last week. So that was very exciting. And yeah. These are our 3 offerings right now. And how would you want to get, and I'll get in touch with it later about how you can get in touch with our program and what that process would look like. But fees wise, so the young adults program, the total fee for the full 17 weeks comes to $4,590, and that could be broken down and paid in 2 ways. It could be paid either in full upfront, or there's also the option to be billed on a weekly basis, which would come to $270 per week. And then there's the teen program, which is $4,050, and again, that would also come down to $270 per week if someone were to select that option. And our preschoolers group, the total fee for that is $5,120, or $320 per week if that were to be the option you would select. So if you are interested, what are the steps to enrolling in our program? So the first step would require, there's of course referrals that are very, very common. But if it weren't to be through a referral, you could of course visit our website for the latest updates of the times and the groups that we're having these. And then you would contact us at the email address right there, csc.peers@nyulangone.org. And there would then be an initial complimentary phone screen that we would do. So that would just be us giving a breakdown of the group, giving the details, answering any questions that the potential attendee could have. And then if it would seem like a good fit based off of the initial phone screen, then the next step would be completing an intake in person with the attendee and the parent, or if it's a young adult it could be a parent with a young adult as well, but the social coach is required to be here for the intake also. And as I mentioned, during the intake, the steps, like the first step is really assessing the interest and the motivation to make sure that they're a good fit based on that, and then appropriateness of the group at the time. And we would just answer any questions that the potential attendee or the parent might have, and then we would go from there. And if they're a good fit, then there'd just be some paperwork after that, and then confirming their spot in the group. And so that's a fast rundown of our program. I know I was trying to get a lot of information in there as quickly as I could, so I apologize if I was speaking a little bit too quickly, but I appreciate it.
Thank you, William. I think we definitely got the gist of the understanding of the program, and definitely we're going to refer folks to it. I think we got enough information. I think towards the end there might have been a bit of a sticker shock for some in terms of the cost of service. I'm just wondering if there's any assistance to cover, partial enrollment of the program, or do you know if there's been some people who've applied and gotten maybe some family reimbursement assistance through that? Considering it's a social skills program, but maybe it could also be considered some type of therapy service.
Yeah, of course, and we do accept certain insurance plans, of course, and there's always the option to submit to your insurance for reimbursement. But in terms of like any decrease in pricing, like that would be something that would be taken up with our billing team over here. So if somebody were to reach out, we would have a phone screen, and then they would have some questions after that, like you said, about the cost, then we would refer them to our billing department, and they could answer any of those questions. They're very, very knowledgeable, and they can make they make exceptions whether they're appropriate, and we would use them to determine that.
Thank you. And I think it's great for people to know that there is maybe a little wiggle room. All you have to do is really inquire, right? Any other questions regarding the CSC Peers program? You could raise your hand or unmute yourself.
Should the information be shared, the slides or the link to the website page that would take them to the referral source, be shared in the chat or to the group?
Yeah.
Great, thank you.
Thank you so much, William.
William, can I ask?
Mary.
Sorry. Can you do me a favor? Do you have a flyer on your program?
We do, yeah. We have flyers for each age group, for young adults, teens, and preschoolers. Yes.
Okay, can I put my our email in the chat? And I'm also going to look into whether family reimbursement would cover that. Because
yeah, absolutely.
Just right on the allowable, non-allowable list.
Yes. And we update our flyers every season as we get ready for a new group. So yes, we do have them for the current groups that we're running.
Okay, because Jackie and I co-chair the Manhattan Family Support Service for Manhattan. So we would share your information. So as you update your flyer, if you email us on a regular basis, when you do, we'll share that information.
Absolutely.
And for anyone sharing information about your services or presenting today, by all means, feel free to send me your presentation or flyer, and I'll be sure to share that with the group. And as you can see, there's several colleagues on that refer folks or are part of other committee meetings that can also share. Thank you again, William.
Thank you so much.
And now Annette Spolino. Annette is from the SIB Shop program at AHRC, and I'll let her tell you what SIB Shop means.
So good morning, everybody. Can you hear me?
Yes, we can. Do you need to share slides, or are you?
Yeah, I
Okay.
want to share something with you. Yes.
Okay, so
So hopefully you can see. Oh, can you all see that?
Yes, we can.
Okay, so let me tell you a little bit about SIB Shop. SIB Shop was created over 25 years ago by a man named Don Meyer out in Washington State. The program is all around the country, all around the world. AHRC has supported the SIB Shop program probably as long as it's been around. I have been supporting this program and running it since 2005. It is a therapeutic recreation program for boys and girls, typical boys and girls, generally between the ages of 8 and 13. There have been years when I've had the program for kids between 5 and 13 or 14. And right now it's 8 to 13, just because COVID kind of screwed a lot of things up. It is, it's like, it's a fun recreation and therapy program for typical boys and girls who have brothers and sisters with special needs. This is not a program that AHRC has developed. It is a program that we trained from. And if you go on, if you see on your page, the Sibling Support Project, just by typing in the siblingsupport.org at the top here in the left, you will learn about what a Sib Shop is. It's really hard for me to explain it. It's kind of like a pedal to the metal fun day where kids get to have activities that are based around group discussion, playtime, and community. And the community is a group of kids who are pretty much in the same boat as everybody else in the group, meaning that they are a brother or a sister to someone with special needs. And typically now in 2023, most of the children have brothers and sisters on the spectrum, and it changes over the years, but generally speaking, that's what the flavor of the day is right now. The program is free. It's one Saturday a month. If you go on the AHRC nyc.org website and type in sibling services, you will get the dates for the upcoming shops. The next one is this Saturday, November 11th, and it's from 11 to 2 p.m. I used to have it from 11 to 3, but again, because of COVID, we're sort of trying to feel our way through this again. It's a wonderful program. It's free. The kids get free lunch. They get to be with other kids in similar situations. They get to have fun. And the child can get a round trip Metro card, and so can the person who brings the child to the program. No one, no parent or sibling is invited to the group. This is a group for siblings only. If you have any other questions, I'm happy to answer them, but I invite you to go on the siblingsupport.org website, learn about the life of a sibling. It's very difficult. I'm sure you can all understand and realize the intricacies of living with someone with special needs. Any questions? I did that in 5 minutes. And a typical day would be group therapy exercises, talking about feelings, talking about what is autism spectrum disorder, what is epilepsy, what is intellectual disability, why can't my brother do this, what is speech therapy, why does he have to go, why can't I go, all that kind of stuff that kids ask. And we play games, we play recreation games, we play group games, we sometimes eat a lot of junky candy, and we just have a community where kids can say what they want to say and feel what they want to feel. And the only thing I tell them is, if you want to hurt yourself or you want to hurt somebody else, I have to tell your parents. But otherwise, this is a free space for you to say what you want. Any questions? It's free. Just bring your kid. We have a good time. And then the December group, I believe, is, I can tell you exactly when that is. We pretty much operate on a school calendar. So we go from October till June. December's group is, oh, darn, I don't have it. It's either the 2nd or the 9th, but if you go on the AHRC nyc.org website and type in sibling services, you'll find the December date. And then as the months go on, I will add the other dates.
Thank
And
you.
everyone is together in one group. Years ago, I split kids from 5 to 9 or 10 were in a smaller kids group, and then the older kids were in another group. But since COVID, we have a lot less kids. So I don't have to split everybody up, and we all work together. Any questions? It's pretty straightforward.
Yeah, Mary has a question.
Not a
Sure.
question. It's actually a comment. You know, my daughters participated in HRC's program when they were younger. And I think it's a great, I think it's a great opportunity for kids to be in a space where they feel comfortable outside their parents, because there's a fear in them of being the responsible person for their sibling when their parent is no longer around.
It's not, it's an absolute fear. It's an extreme anxiety provoking situation in life that they know at a very early age, they are going to be responsible.
But I think it's very hard for them as younger children to approach their parents, where I think it's very good that they have this outlet. I also think it's a great guideline for someone to teach people how to explain that to their children. I came across a great article once about how much I love you, but you're not responsible for your
Absolutely.
and I put it on Facebook, and it was funny because people thought I wrote it. I was like, no, can't take credit for that.
Yeah.
But
I have so many articles like that, you know, that I've given
They're very
parents over
helpful.
time. And I sometimes spend time with the parents talking. I don't have that time now because I actually run the group with another person who happens to be a special education teacher and a sibling of someone with special needs. So, you know, I used to have more time for the parents and I have less time now, but these articles are very important. And what you're saying is extremely important to help parents, to give them a language and
Right.
to give kids a language. Yeah.
And a space to speak what they're thinking without, you
And a
know,
space.
guilty, because that's what they feel when they voice that. They feel guilt. And
Yes, they do. Yes, they do.
so I
Yeah.
just applaud your program, and I just had to say that. Thank you.
Thank you. Thank you. I love the program. I think it's a brilliant program. And like I said, it's everywhere. If you go on the sibling support, you'll look and see where all over the United States these groups are. We meet once a month as a group of providers. Don is now since retired, and Emily Hall is now the director. And Emily used to work for YAI, and she has a brother with special needs. So I'm well connected at sibling support. I know all these folks. I've been around for a very long time. As you can see, I have lots of gray hair. So this is a very near and dear project to me. Yeah.
Thank you, Annette. And I do want to point out for the professional colleagues on this meeting, we know that you work directly with the person supported, right? The person that has the OPWDD eligibility, but we always, when working with the person supported, you know, get to know the families, right? And as such,
Right.
even
We have
if
to
you don't
work as a
provide,
whole.
yeah, even if you don't provide support to the siblings, by all means, please do mention the program to
To the parent,
the
and the parent
parents.
can call me. Just give them my telephone number here at AHRC is 212, and I'll put it in the chat. You know what? I'm going to stop sharing, and then I'll put it in the chat for you guys. Where's the chat? Da, da, da. There it is. I will type my telephone number, and parents can call me. And they can just tell me about their situation, and they can enroll their child. I don't need any OPWDD paperwork. Yay! It's free.
This is great. And I think it also serves as a way, and correct me if I'm wrong, Annette, as a way to really teach communication skills to your children as well. You know, a way to learn how to express yourself in a positive way, right? Not acting up or anything like that, but really learn how to communicate with your own family and friends
Yes.
and
And
other
to learn the
siblings.
learn the language of the disability world, to be able to put a label to someone's feelings and a label, like I'm not looking to label any kid, but a lot of parents will not tell their siblings, their kids, that your brother has autism. They don't want to label their kids. But my kids will come in and say, my brother, falls out in the street. My brother takes his clothes off, whatever it is. And it's like, well, let's kind of talk about what that is. And, they may go home and they may say, Mom, I learned this word, parents have to deal with what's reality, they do. And I understand parents not wanting to do that. But, kids are going to ask, and they ask me.
Well, it also
Okay.
depends on where the parent is in the process,
It
it's-
is a process. It's a
No,
huge-
but the process of the diagnosis is,
Yeah.
what I'm referring to. So
Yep.
sometimes the parents getting comfortable themselves and they don't really
Oh,
know
yeah.
to
Yeah.
address it with their
Yeah.
children yet.
They don't have the language. They don't have a language.
They don't have a lot of things. We learn as it takes a lot of
As you go, you learn as you go. Yeah.
Well, thank you again.
Yeah.
And
Oh,
just
hi, Mrs.
last chance
Lewis.
for anyone who has a question for Annette.
Wendy, I just wanted to ask something really quickly.
Sure.
Are you able to hear me?
Yes.
Okay. I was wondering if there was anyone that spoke another language other than English available to work with the children. Or as part of the intake process, maybe the children speak English, but their parent might not.
Yes. Are you asking me or Wendy?
No, just this is a
I
you
was
question, Annette.
asking you, Annette, sorry.
If you let me know that there is a parent who only has English as a second language and their primary language is Spanish, I will get somebody to call that parent. I don't speak Spanish. My co-leader speaks a little bit of Spanish, but I will get someone in my department to call that parent, to introduce them and to get all the information and to get it sent over.
All right, great, thank you.
Yeah.
And thank you again, Annette.
You're
I
welcome.
didn't see anyone else with their
Okay.
hand up. If you have a flyer or anything for the program, again, please send it to me and I'll be sure to share it with the group. I'm sorry, I spoke too soon. Jacouti? I'm mispronouncing the name.
It's okay, it's okay. Just to Mrs. Paliano, if you can share your phone number again in the chat. For some reason, when you shared it the first time, it's not showing in my end.
Okay, I will certainly do that again for you.
Thank you so much.
How about that?
Oh no, you're sending it directly to me, Annette. That's why people can't see it.
Oh, okay.
Yeah, if you could send it to all in the meeting. I
The
just
drop
realized that.
down, the drop down
I see
probably
it,
says
I see it.
Wendy.
Okay, there you go.
There we
Sorry
go.
about
Yes.
that. I didn't do that.
Thank you.
Yeah. Thank you again.
All
And
right.
now we have our next. Sorry, I just realized I muted myself. So our next presenter is Priya Mohavir from Adapt Community Network, talking about a new initiative called Start Here. And Priya, I see you went ahead and shared, so thank you.
Yep, you're welcome, Wendy. Hi, everyone. My name is Priya. I am the administrative coordinator for the Start Here website. Start Here is a website that was created to offer a one-stop shop of helpful information and resources to support parents of children with disabilities. What separates this website is that it is geared specifically towards parents. Information on how to advocate for your child and questions to ask professionals and apps you can use are some of the items you can find on the website. This is an image that's on the website. This is when you first hear that your child has a disability, and as parents, you don't know where to go, you don't know who to ask. This website is helpful in walking you through steps on your next steps. This is also another image from the website, and it gives you blurbs on what to do when you want to connect with other parents, you want to speak to a doctor, give yourself time and form a care team of people that you will need to talk with, about your child. And there's also a lot of other helpful information on the website on tips that you can use. Also, a few months ago, we had a parenting groups, and we used this parenting group to help us with content on our website. And they gave us recommendations on things they would like to see on the website, and what they thought about the content that we had up there. Like I said, it's a wealth of information and recommendations that you can use. If this is something that ADAPT is choosing to do in the next couple of months, if any of you are interested, please let me know in the chat, and we'll get your information to start a parenting group. And this is the information. This is the website, starthereparents.org. And you can also find us on Facebook and Instagram at Start Here Parents. Thank you.
Thank you, Priya. And I know it seems like most of it is geared towards parents just starting out in this journey of diagnosis for their child, or just kind of getting started in the whole process. Would you say this website is also helpful for parents who have kind of been around for a while, are several years past the diagnosing phase, and are established within the community just as a way to them connect or get more
Absolutely. Like I said, when we had the parenting group, we had parents that have been around for 20, 30 plus years, and they have been very helpful to parents who are just learning that their child has a disability. They can ask them tips, recommendations, suggestions. They have their own resources that they've been using over the years that, we may not even know, or that's listed on the website that I think will be very helpful to parents just finding out that their child has a disability.
Thank you. Any questions for Priya? You
No,
go ahead and
That's brilliant. Brilliant.
Thank you.
Alrighty. If anyone has any questions or comments, wants to unmute themselves, by all means.
And I'll go ahead and I'll put the website in the chat just so that everyone has it.
Thank you.
And please follow us on Instagram and Facebook. I had to plug that in.
Thank you, Priya. And if you could just stop sharing your screen, can. There we go. Again, thank you so much. And I just want to plug in again, these resources that we're hearing about, you can find more like them or more about them also through the Family Support Services Directory on the Manhattan DD Council website, which is manhattandcouncil.org. Again, that's manhattandccouncil.org. You just go to the site and there's staring you right in the face, Family Resource Directory, right there centered on the page, so you can learn about these services and more like them. And now, without further ado, I saw him earlier, David Krasnick is here to talk to us about Hamaspic home care services. So David, take it away.
Thank you very much, Wendy, for inviting me today. I'm going to try and be as quick as possible, not to take much of anybody's time, but I have some important information to share about home care services. The presentation is going to be about home health aid and CDPAP services as it applies to OPWDD. And I'm going to as well as after the presentation, I will just let everybody know that, or before the presentation, that we also assist with ABA therapy, physical, occupational, and speech therapies. We have vendors that we work with that we assist the population with. So I'm going to, just give me 1 second. I'm going to share my screen. Everybody could see my screen?
Yes, we can.
Okay, perfect. So I'm going to try to be as brief as possible. But like I said, this is a not so well-known topic with care managers and OPWDD professionals in regards to home health aid and CDPAP services. Who's eligible, who's not eligible, what services conflict with home care, what services don't conflict. So home care is a Medicaid program, especially long-term home care. I know Medicare can cover about less than a month of home care services, but if the individual needs long-term home care and CDPAP, it's a Medicaid-only program. So who is eligible for home care? Anybody who needs assistance with dressing, transferring, toileting, hygiene, bathing, ambulating, meal preparation, needs help with light housekeeping, hygiene, stuff like that. Who is eligible for home care and CDPAP services? I'm going to discuss CDPAP later in the slides. So anybody who is at least 3 years old after early intervention, they have their waiver code. We assist individuals even before they have their code 95 OPWDD waiver code. But usually it's harder for them to get approved. So once they're 3 years old, they're on Medicaid waiver for OPWDD. It's easier for them to get approved for services. The criteria for home care is anybody who needs assistance with personal care needs, ADLs, activities of daily living. So whether home care is not only for seniors, we specialize in pediatric home care, pediatric home health aid, and CDPAP services. CDPAP is the Consumer Directed Personal Assistance Program, where instead of us, Hamaspic, sending a certified home health aide to the home, the designated representative on behalf of the child or adult with special needs can designate some workers, the family members, friends, neighbors who are not certified, not fingerprinted or background check. There's no need for any of that. There's no certification or training necessary for CDPAP services. And the representative or parent can choose staff to get paid through Medicaid. There's no cost through Medicaid. And they get paid. We bill Medicaid and we pay the staff. And this could be family members, friends, neighbors, anybody who's over 18 and has a working social security number. So home care will not be approved for housekeeping only, meal prep and supervision, unless there's a need for assistance with ADLs. So the main criteria for home care is ADLs, activities of daily living, as well as personal care needs. Anybody who's eligible for home care services, traditional home care services, where a certified home health aide or personal care aide comes to the home, will also be eligible for CDPAP services. So there's two different models of home care, traditional home care versus consumer-directed home care. Again, let me know if I'm speaking too fast. I'm just trying not to take too much time. With traditional home care, our caregivers that we send to the home are trained, fingerprinted, they're vetted, they come with references, and they're vaccinated against COVID. Hamaspic hires and schedules the caregivers. our field nurses, our nursing staff supervise the caregivers, and we provide home health aid, traditional home health aid services in the 5 boroughs except for Staten Island, which we currently are short-staffed. And we provide also in upstate New York, in Rockland and Orange counties, we have, as well as Sullivan County, we have home health aid and personal care aid staffing. Consumer directed home care, CDPAP, is a slightly different but mostly the same. How so? CDPAP, the caregiver, the paid caregiver is also taking care of personal care needs, personal care tasks, ADLs, activities of daily living, but is also not trained, not certified. They could be certified if they want to be, but they don't need to go through a training program. Some agencies offer this only offer CDPAP with OPWDD and make the individuals who are getting hired go through an HHA training program, which is not necessary for CDPAP or for OPWDD in general. The consumer or a designated representative, right? A designated representative is advocating on behalf of a special needs consumer who cannot advocate for themselves. The designated representative recruits, hires, trains, schedules, and supervises the caregivers. We have CDPAP available with Hamaspic in all of New York State. Hamaspic Home Care is a fiscal intermediary, an FI for CDPAP, not to be confused with an FI for self-direction. Hamaspic bills Medicaid, and we pay the caregivers. So we're an FI, we're an intermediary between Medicaid, between HRA, between the managed Medicaid plans, and the consumer, the family, and the workers. Since it's the designated representative's job to train the caregiver is not limited to standard home health aid training. What I mean by that is, with CDPAP, the workers can also perform nursing tasks. A regular home health aide, a regular certified home health aide is not trained to perform nursing tasks. They can't even give the individual medication. They can only help with the reminders for medication, in addition to the personal care tasks that they do. With CDPAP, the workers can also administer medications, assist with feeding tubes, administer insulin, and check vitals, all nursing tasks. As the designated representative on behalf of the special needs consumer accepts the responsibility upon themselves to train the workers with the needed nursing tasks. What are the CDPAP restrictions? Who could be the caregiver? As I said before, there's no training, there's no 3-week training course or certification program necessary. There's just a few rules. Cannot be the client's spouse, the consumer spouse, cannot be the parent or client of an individual under age 21. So basically, according to the New York State Department of Health, anybody who's over 21 can have their parent or legal guardian be the caregiver. There's a misconception out there with care managers and OPWD professionals that that CDPAP is only for adults and not for children. Children can receive CDPAP as well. It's just that the parent or a legal guardian of an individual under the age of 21, cannot be the caregiver. They can choose anybody else, any other family member, grandmother, grandfather, sister, brother that's over 18, aunt, uncle, friend, neighbor. And also the designated representative who's advocating on behalf of the consumer, of the special needs consumer, cannot be a CDPAP worker. It's a conflict of interest. The designated representative is there to help schedule, help with scheduling, sign timesheets if applicable, hire and fire staff. They're making decisions on behalf of the special needs consumer. So therefore, it'll be a conflict of interest for the designated representative on behalf of the consumer making decisions for CDPAP to be the caregiver. So who could be the caregiver under CDPAP? So the worker must be at least 18 years old, must be legally allowed to work in the U.S., basically have a social security number, and needs to undergo an annual physical examination. Now, HRA CASA used to require, in addition to what the DOH requires, they used to require chain of custody drug screen, but that recently, within the last 1 to 2 years, they relaxed that rule. So really, it's only 18, working social, and have an annual physical examination. So who pays for CDPAP and home health aid personal care aid services? So managed Medicaid, your United Healthcare, Affinity by Molina, Fidelis, Empire, those plans usually approve for less hours. Straight Medicaid usually approves more hours than managed Medicaid. There's no middleman. The managed Medicaid plans are like they tend to try to make money off the consumer or approve for less hours just to keep their profits up. So straight Medicaid is managed by the local Medicaid office. So in New York City, that's HRA CASA. We have a contract with HRA CASA in the 5 boroughs. CASA usually approves for more hours than the managed Medicaid plans. So how to choose? I know that most individuals with OPWDD are waivered and have as pediatrics, most of them have managed Medicaid plans because they haven't received their NOD. Some of them haven't received their NOD yet and weren't able to apply for straight Medicaid. Straight Medicaid only applies for individuals who already have waiver. Managed Medicaid plans, you see a lot of pediatric individuals who have managed Medicaid plans. Most adults with special needs with OPWD eligibility have straight Medicaid, but not to be confused, we don't only accept straight Medicaid, but managed Medicaid plans tend to deny or give very few hours to pediatrics. That's why we recommend they switch to straight Medicaid. But if not, we could try to make it work for the family. If the family is not looking for so many hours, or if the individual is not totally dependent on the service, we could try through the managed Medicaid plans that I listed in the previous slide. So about MLTC, managed long-term care plans, a lot of care managers and OPWDD professionals think that CDPAP will make the waiver services, care management service, OPWD waiver services, care management services fall by the wayside, when it's really the only thing that really causes an individual to lose their Code 95, their OPWDD waiver, is enrolling in an MLTC plan, a managed long-term care plan, a MAP plan. Basically, it's called a managed long-term care plan, which is geared towards seniors. Most home care agencies are only geared towards seniors, so they try to have the family enroll in an MLTC plan so that they could bill. We specialize in OPWDD home care and CDPAP. There's no need for us to bill MLTC. We go directly through HRA, local DSS, as well as the HMOs, the managed Medicaid plans, so that the individual doesn't lose eligibility for care management, care coordination, or waiver services. As I mentioned, we accept straight Medicaid for both home health aid and CDPAP services. Straight Medicaid goes through HRA, especially for CDPAP in the 5 boroughs. They administer straight Medicaid as well as other welfare programs in the 5 boroughs. CASA, as I'll mention a lot throughout the slide, is the home care division of HRA. HRA is the Human Resource Administration, is the DSS, the Department of Social Services in New York City, and pays for home care services for individuals with straight Medicaid. So HRA CASA requires 2 designated representatives. So again, designated representatives are, especially in the OPWDD cases, you need designated representatives. They're advocating on behalf of the consumer with special needs. They're setting schedules with our coordination team. They're filling out timesheets. They're making decisions for CDPAP. In addition to the designated representatives, the 2 designated representatives that are required, at least 2 caregivers, CDPAP workers, family members, friends, neighbors, who are signing up and clocking out are needed for each CDPAP consumer. So we see that anybody with straight Medicaid CDPAP going through CASA requires 4 people, at least 4 people, 2 designated representatives, and at least 2 caregivers. So Hospice Home Care does not only accept straight Medicaid, we're affiliated with most managed Medicaid plans as well. We accept United Healthcare, Affinity by Molina, Fidelis, Empire Blue Cross Blue Shield for CDPAP only. We accept MVP Health Plan, Hudson Health Plan in the Hudson Valley for CDPAP. In addition to those plans, we also, for PCA, for Personal Care Aid Service, we also accept Health First and HIP Emblem. So we accept plenty of managed Medicaid plans. Again, managed Medicaid may not be the best option for pediatrics because they tend to get denied or get very few hours. But adults, they tend to get less hours with managed Medicaid, but it's not a huge disparity. Now I'm going to discuss some waiver services as well as how the waiver services apply and the waiver service programs conflict or overlap or coincide with CDPAP and home health aid services. So OPWDD Code 95, that's one of the major waiver programs, entitles eligible individuals to receive services such as day habilitation, community habilitation, day hab, ComHab, respite care. I was on the phone call with Bronx OPWDD yesterday, and they told me just an announcement that they're tending to not approve standalone respite by itself, and it would need to be connected with other OPWDD programs. So individuals who are receiving standalone respite or need respite could also apply for CDPAP. The CDPAP is also assists with ADLs and there's a week daily schedule for CDPAP. Respites, once in a blue or once a week. CDPAP is more of a long-term solution, as well as individuals residing in an IRA or ISS housing. An individual residing in an IRA cannot receive home care or CDPAP services because it's Medicaid double billing. The individual in an IRA already receives support with ADLs, so that'll be Medicaid double billing. In the ISS apartment, the individual lives independently and therefore can indeed receive home health aid or CDPAP services. There's also NHTD waiver, code 60, and TBI waiver, which I'm not going to discuss, but those are other waiver programs in addition to OPWDD. So does ComHab coincide or conflict with home health aid and CDPAP services? So if there are ADL related goals in the life plan, the home care worker cannot be present at the same time as a ComHab worker. So the care manager has to be careful. Care management teams need to be careful to delineate everything clearly in the life plan, that if the individual is receiving ComHab, for example, the ComHab worker and ComHab and CDPAP, the ComHab worker shouldn't be assisting with lifting and toileting and feeding and dressing, stuff like that, because that will overlap with home care services, home care, home health aid, and CDPAP services. The goal is for the ComHab worker to assist with skills, money counting, society integration, teaching the individual, for instance, training and teaching the individual how to have a trade, a job. If there are no ADL related goals, the home care worker is approved at any time to work with the ComHab worker at the same exact time. If there are ADL related goals with ComHab, the home care worker must work different hours than the ComHab worker. So as I mentioned before, in an IRA, the individual cannot receive CDPAP or home health aid services. That's a Medicaid double billing. In an ISS apartment, it should be fine. Day hab respite, same idea. Home care worker cannot work at the same time as these services are being provided. Day hab DSP, the direct support professional, is responsible for providing with ADL assistance, personal care assistance, and the respite provider is also responsible for ADL assistance, personal care assistance. But during other times of the day, the CDPAP or home health aid worker can indeed clock in at different times, but not at the same time as the day hab or respite worker. This is a major thing that I'm about to discuss. A lot of care managers and OPWD professionals, when they think of home care, they think of the M11Q form, the medical request for home care. But for individuals who are over 18, that recently changed as of May 2022. Anybody who's over 18 needs to, first of all, the care manager would send me the information, then we would give we would verify the Medicaid, and then we would have the family, if the individual is over 18, contact the New York Independent Assessor. Their phone number is over here. I'm going to share these slides after the presentation, so you have their phone number. There's two assessments: the nursing assessment, which is about 3 hours, and the clinical assessment, which is either done by a nurse practitioner or a physician's assistant, which is about 1 hour. They're within 14 days of each other. And I always recommend that the families choose Zoom over personal appointments, in-person appointments, because Zoom sessions are easier to get. They're sooner appointments, and we get the aid in the home, or we can get the CDPAP workers to start clocking in and clocking out sooner. Once the NIA, the New York Independent Assessments, are completed, and once CASA or the Managed Medicaid plans approve their part, and once obviously the workers are signed up properly and onboarded properly. So after these assessments, the completion letter, the NIA, the New York Independent Assessment, New York Independent Assessor completion letter, will be mailed to the consumer's home address, and Hamaspic Home Care will need this letter to submit to CASA or to the Managed Medicaid plans. They'll need it to access the assessments. Under 18, individuals who are under 18, the M11Q form is still required. The medical request for home care that the doctor fills out is still required. The DOH 4359 form is outside of New York City, so this doesn't apply to this group. NYC residents use the M11Q form outside of New York City. The DOH 4359 form is used. Sorry if you hear my daughter crying in the background. I'm working from home today. Consumer enrollment process. So CASA requires either the NIA assessment, the New York Independent Assessor, for individuals over 18, or the M11Q form to be completed by the doctor. There's no doctor's notes for individuals over 18. CASA also requires a CDPAP application. The Managed Medicaid plans require an MOU form, a memorandum of understanding, in addition to the NIA assessments or the M11Q form if the individuals are under 18. Both the CASA form and the Managed Medicaid MOU form for CDPAP are completed by the designated representative. So the CDPAP enrollment process, either CASA or the local DSS, Department of Social Services, or the Managed Medicaid plan will do a plan of care authorization. They'll authorize the amount of hours per week. The doctor completing the M11Q form does not make any decisions in regards to how many hours the client receives per week. New York Independent Assessor does not make any decisions for weekly hours. That's all done by the insurance, whether it's Managed Medicaid or whether it's HRA. When contacted, the consumer designated representative must request Hamaspic Home Care. Otherwise, they'll be in limbo as the provider. So with the CDPAP enrollment process, at the same time as we are helping the family enroll and apply for CDPAP, the designated representative must identify PAs, personal assistants, to work for the individual who want to get paid to work with the individual. The PAs must complete Hamaspic Home Care's employment enrollment requirements before starting work. So there are times I have to say this where a case gets approved by CASA, or a case gets approved by, like, let's say United Healthcare managed Medicaid, for example. There's no work. The workers didn't sign up yet. The workers, we try reaching out to the staff. They didn't sign up. We can't pay them without the W-4 and the I-9s filled out, and all their employment paperwork filled out. And there's no worker to work on the case. So sometimes once the case is approved and there's no worker to work on the case, CASA or the managed Medicaid plans gives us 30 days to start services. If the services are not started within 30 days, we have to defer the case back and the case gets closed. So it's very important that workers sign up in a prompt manner and a speedy manner, so that by the time the case gets approved, the case is ready to go. For a traditional home care enrollment, straight Medicaid, traditional home care, Hamaspic Home Care has a contract with HRA CASA for CDPAP only. But what we do for individuals with straight Medicaid who need traditional home care, we go through certified home health agencies. Hamaspic is a licensed home care service agency, meaning we staff and provide coordination. The certified home health agencies that we that have us assist with the case, they're the ones who get the approval from Medicaid, and we're the ones who staff the case with certified home health aides and personal care aides. I mentioned the New York Independent Assessments. For managed Medicaid, for regular traditional, for managed Medicaid with traditional home care, if the individual wants traditional home care with managed Medicaid, the New York Independent Assessments must be done. For traditional home care with straight Medicaid, it does not need to be done. There's a special referral form that is completed. So I hope I was quick. Any referrals or questions, whether you feel like it's a dumb question, there's no dumb questions, there's only dumb answers. Whether it's any questions at all, reach me anytime, before hours, after hours. Referrals or questions, or feel free to contact me. I'm going to share my, I already shared my email address and phone number in the chat. This is my direct line. There's no extension. So I'm now going to open up the floor for some questions.
David, I think you had a question in the chat.
Yes, Lisa, thank you.
I can't see.
I can read them if you want.
Sure.
Someone said they just wanted to clarify whether CDPAP, home care, and home health aid were all the same thing.
So CDPAP, home health aid, traditional home health aid is different from CDPAP. Traditional home health aid is when we send a certified home health aid, trained, fingerprinted background check to the home. For a family that doesn't have any support, doesn't have family support, that can't choose any family members or friends or neighbors to be the paid caregivers. And CDPAP is when the family member on behalf of the individual chooses family members, friends, neighbors, instead of a home health aide, instead of traditional home health aides, to work with the individual at home.
Thank you.
My
and
pleasure.
then the next question is, can a traditional CDPAP be approved for a 25-year-old ASD child whose need is to be helped with cooking, shopping, and when out in the community for the purposes of safety?
So I mentioned the different waivers. When it comes to home care is not meant for oversight and supervision, safety. It's meant for personal care, assistance with personal care, and ADLs. So like there's a waiver called an NHTD waiver, nursing home transition diversion waiver, TBI, traumatic brain injury waivers, that are more assisting with oversight and supervision. But the individual, this individual that you're mentioning, must need assistance with ADLs, core ADLs, personal care tests, in order to qualify for CDPAP. Just taking the individual into the community, just cooking or housekeeping by itself won't qualify. the major ADLs that the personal care tasks the individual should need assistance with those as well.
Thank you, David. Someone's also asking you to put up your contact information again, if you can.
Sure.
And everyone, we know that this, there's a lot of components to these types of services. My suggestion is always to speak to the professional directly about it, because I'm sure that everyone's questions is because you have someone in mind. And so you have very specific details about that. So by all means, please contact David directly. If you're not sure how that mixes in with some of the services you already have, that's part of what your care manager is there to assist you with. And I'm sure that both care manager and David would be more than happy to have a conference call if needed, to iron out some details and clarify some things as well.
Definitely. Any other questions, if I may?
So for those of you looking for David's contact information, it's now in chat. And anyone who has questions, you can unmute yourself or raise your hand and I will call on you. Don't see any. So David, again, thank you so much for all that great information. I know I'll have to review the PDF again once you share, well, you have shared it, just to kind of go through that information. And I will be sharing David's information and his presentation, as well as that of the other presenters who would like that information shared with everyone who attended, as well as just the general DD Council email groups. The recording will also be made available through the DD Council's YouTube page. So if you have not visited the Manhattan DD Council YouTube page, please do so, and please subscribe so that you can continue to have access to these recordings and that of previous meetings as well. Mary, I saw you turn on your camera, not to signal you out, but does that mean you have a question or?
No. I just, what's it called? I was on the phone, so I didn't want to have my camera on. And then I forgot that I didn't take it off. So I just
No worries.
There you go. Thanks.
Thank you. Well, that is all in terms of our presentations for today, but I do want to say we are looking into updating the Manhattan Family Support Services directory in the next few weeks, possibly a couple of months. I may be too hopeful there by just saying a couple of weeks. It's likely a couple of months. But if you would like your information included in the Family Support Services directory, and let me just say that directory is for family support services, which, David, unfortunately, your particular service does not fall under that, because it's beyond just family support. It's really encompasses a lot of different services. But for those of you representing family support programs or that may know about family support programs that you feel were not included in last year's update of the directory, by all means, please email me. I will put my email in the chat for you now. Or simply, you can look up any of the executive committee members, which are any of the co-chairs on the Manhattan DD Council.org website, and communicate with any of us regarding information about your particular service. And we will be emailing those that are already listed for updates on your contact and so on. David, yes.
So, yeah, I did share with you the presentation before I presented today,
Yes,
about
yes.
around 9:45.
Yeah, I remembered as I was speaking that, yes, you did
Okay,
send me
perfect.
that email. So I'll make sure to put it together with the other information that we got as well.
And
And I'm sorry, did I?
could you copy me on that email if you don't mind?
Yes.
I appreciate it. Thank you so much.
All attendees will receive it. Oh, I see another question here on the chat. Can any of the providers here consider having a present? Okay. Thank you for the idea. Yes, we can definitely consider future presentations. By all means, please email me if you have ideas on any topics that you would like us to cover. Which brings me to the mentioning of our next meeting. Our next meeting will be January 10th at starting at the same time using the same link. And we hope to do that, Luisa, if we're still on for the same topics we discussed. It will be on justifications and advocacy for certain services. We know now there's been changes on the requirements for certain services, not to bring up the same one over and over again, but like family reimbursement that requires certain justifications, and also a little more advocacy on the behalf of the either professional or the parents, to really emphasize the need for the service or the program or the goods. So we will be discussing the best way to go about that, what should be included in justifications, and so on and so forth. And that'll be January 10th. Again, same time and using the same link. Lisa, is there anything that I'm missing? Anything?
Nope. So our hope really with that topic is that it's come up quite a bit. There've been a lot of changes with the processes happening on OPWDD side when it comes to approving of services. As David had mentioned on his call with the Bronx, that they are not approving things that maybe they might have approved a year ago, and definitely not approving things in quite the same way they did 3 years ago, 5 years ago, and so on. So as family members, it's important to know what it is that is being looked at. As care managers, it's important to know and be prepared for having the most complete packet possible. And as providers, just knowing that there's some additional hurdles that have to be gone through in order to attain services and to complete those preliminary steps. So hopefully that presentation will offer some insights, some clarity, and maybe some new tips and tricks for moving things forward in a more timely manner.
Thank you, Lisa, and thank you all for attending. We hope that you have a great rest of your day. Again, thank you.
Take care.
Bye.